Thank you for joining us today for this spotlight on COVID. With me is Sridhar Venkatapuram. If you'd like to introduce yourself.
I work at King's College London at the Global Health Institute, and my titles are I'm a senior lecturer, I am head of global health education and training at King's, and then also acting deputy director of KGHI.
So today we're going to be discussing a little bit about law, policy, and ethics in relation to the COVID-19 pandemic. A lot of the discussion so far around the pandemic has focused on epidemiology, biology, and psychology. How can global health and ethics enrich and expand our understanding of COVID-19 as a disease and the pandemic more widely?
Yeah, that's a fantastic question. That's basically asking me to justify what I do and why you do it. So I think, put it very simply, I guess for people who don't know what ethics is about, just think about ethics in a medical setting. Just imagine if we did medicine without any ethics, or if we did research without any ethics. What we do try to do in those arenas is that we try to ensure that there are certain kinds of ethical values that are infused even in the science and the medicine that's actually being discussed or analyzed. And even when we do research, we want scientific power, but we also want to make sure that the people that are involved are treated ethically, that we don't violate some basic principles. In the same way, what I've been doing and what sort of global health ethics is about is not clinical and not medical or research, but thinking about public health policies. What are the different kinds of ethical issues that are involved in the different kinds of scientific epidemiological arguments or epidemiological practices? And then these also at the global health level, is that at a global transnational level, the kinds of ethics are different than what they are at a national or subnational level.
Okay, that's really interesting. So more broadly, in your new book you've co-edited called Vulnerable, you're exploring the ways that people are perhaps rendered more vulnerable by the policy decisions that are made during pandemics. So how should we be allocating resources in a pandemic in an ethical sense?
Yeah, this is a terrific question as well. So I think most people in the beginning of the epidemic thought that this was just about how do we allocate ventilators or ICU beds. And what we know is that resources come in all types. There's money, there's people, there's time, there's physical materials, all these kind of things are involved. And so really what we want to highlight is that policy of all kinds are actually distributing resources of various different kinds. And what we really want is to focus on, one, the concept of vulnerability, that the pandemic is not random. It's not just affecting everyone. It's affecting certain kinds of people with certain kinds of disadvantages and vulnerabilities. And so one is that resources in terms of response should be trying to be allocated to the people that are actually the most vulnerable, rather than generic policies that actually help no one. And then also thinking about the response, but also the recovery programs, is that the countries around the world have either borrowed trillions of dollars in order to pay for furlough programs or to pay for research and other kinds of stuff. And this money is going to have to come from somewhere. It'll come from the future people. And so what we really want is to be able to think about equity and vulnerability also in the future, and how recovery programs should be thought about. And so this book brings together about 70 sort of authors and looks at different things such as federalism, what sort of resources need to be thought about at a federal level, at a subnational level, what sort of resources should we be thinking about in terms of work conditions and understanding which work conditions are actually dangerous and which ones not. We need to think about different ideas around social equity and the fact that certain groups of people are disadvantaged because of their social exclusion. And so how do we ensure that resources are allocated towards them? The idea is that if we don't do that, then essentially what you're going to do is you're going to actually make social inequalities much worse than they already are, which makes it more likely that the next wave is going to be worse, or the next epidemic is going to be worse, that their health will be worse, and that the country itself is not resilient for future health threats. And also, as we know, we're all interdependent. And so all countries need to do this much better, because if one country doesn't do it well, that means that other countries are going to be affected as well. So I hope that that answers this question about resources, is that we need to think about resources in a much broader way, identify what vulnerabilities already exist and try to mitigate those, but also thinking about what are the vulnerabilities that we've created through our policies and that we're going to see in the future.
For sure. It's obviously a very complex issue. I was wondering if you had any thoughts on how policymakers could make more equitable decisions and programs in their pandemic response, both current and future.
Well, so I think that what's happened now is that there's so many different kinds of policymakers. This is one of the things that I've learned about. We talk about policymakers as if they're one group of people sitting in one room. There's policymakers at the local level, at the city level, at the state level, and as a national level. And also now we know that there's policymakers at the international level. One of the most important things is that we are losing the sight of what the actual focus should be of our policies, which is that when we say protect the NHS, we protected the NHS, but we didn't protect the human beings. And so many people died outside of the NHS as a result of our focus on the NHS. And that similar way, I think the number one thing is policymakers need to understand that the primary thing that we're interested in is human beings and their well-being, not are we interested in the market? Are we interested in the system? Are we interested in institutions? So that would be my number one lesson for all of this, is that human beings have to be the central focus of policies, not aggregate indicators or institutions.
That's really interesting. Thank you so much for joining us today.